Hello, this is Dr. Lorenz, Longevity Health Institute here, bringing you the best, right? Always in personalized functional medicine. So listen, today I had to do a video on this and had to share this with you. Why? Because two patients brought up to me something really common and it's seasonal, and that's called vertigo or benign positional vertigo. So let me dumb this down, slow it down so you kind of understand. But I'm bringing you this video in the spring. It's April actually. And this is very, very common, and we see peaks of benign positional vertigo or any type of vertiginous effect in the spring months. So March, maybe end of March, April, May, and then October, November, maybe December. And there's reasons to this I'm gonna explain. So it's bookended at basically these months. Very atypical to get benign positional vertigo or labyrinthitis, which I'll get into. In the summer or in the middle of winter and that kind of thing, because the weather does play a role. But let me explain. So what is this? It's this severe spinning or nausea related to feeling lightheaded and the room moving and all that. It isn't just a lightheaded feeling. It isn't just like I don't feel right. It's truly a spinning sensation. And the reason is because something called the labyrinth, which is the inner ear structures of near the brain, there's hairs in there and there's signals sent to the brain and the cerebellum about position. And when this labyrinth creates what we call labyrinthitis, which is like crystals or clumps that can be caused by environmental changes, barometer changes, humidity changes, so weather, okay, but also viruses can cause this, and also bacteria can cause it, so like a sinus infection in that. But also you're more prone to this when somebody's got high stress and also has an adrenal dysfunction, which you've heard me in other videos talk about cortisol and your adrenal fatigue and adrenal hormones, okay? So again, risks are weather changing, barometer being dynamic, humidity, things like this, spring and fall. And again, though, if you're more prone to or have any virus going on or chronic viral syndrome, could even be as simple as on and off chronic shingles or on and off chronic herpes, which is 1 in 4 people, and bacteria can do this. But this inflammatory effect clogs up the labyrinth system. We get labyrinthitis, and it sends signals to our brain that are like, yo, our head doesn't, even though it's straight or it's looking left or looking right, it feels like it's spinning, and so we get this vertiginous effect. So that is benign positional vertigo, okay? So now what do you do about it? Well, again, today, just today, I had 2 separate calls on it, one early in the morning and one midday, so I'm like, I probably should cover this because this is prime time where we see, and I have seen for literally decades, is this BPV, benign positional vertiginous vertigo, okay? So we know what it is now. What do we do? Well, there is a maneuver, and it's a technique, and you can just go on YouTube or you can go on in the internet and look this up, okay? But it's called an Apley maneuver, and somebody has to do it for you and show you typically, or you watch a video. You're really going to need help to do it yourself. What it is a head positional and a body positional change thing. It's very specific because it starts to get the hairs of the labyrinth to wake up and to move, if you will, okay? And so it really makes it worse first, but it literally can stop. So this patient had this benign positional vertigo before. When she reached out to me this morning, I had her do an Apley maneuver on herself, and her husband helped her too, and this literally stopped it. So she's doing much better right away, okay? But that can be very effective, but it can aggravate you before you're better. Technically, I've had people do the Apley maneuver and literally vomit, okay? So it could make you worse before you're better. So keep that in mind, okay? The other thing is, forgive me, the other thing is that certain things that we do here at Longevity Health Institute are very, very, very beneficial. So we use a hydrosol silver nasal spray, which keeps the sinuses open. You can do that liberally. That treats bacteria and viruses. It's very immune enhancing and anti-inflammatory. And after a neti pot flush, because a lot of this stuff can come with, the vertigo can come with chronic sinus stuff and a lot of inflammation in the sinus. But that helps the sinus flush out and be antimicrobial. And you do that liberally, and even after doing a neti pot or blowing your nose, you use silver 3-4 sprays in each nostril. Okay, we like to use a nanoparticle silver, so it's a lot more smaller parts per million, and that penetrates a lot better. And you can liberally use that. If you plug your nose and blow, that blows the silver up deeper to be deeper antimicrobial, deeper into the sphenoid sinus, into the eustachian tubes, but that can be very beneficial. Also, any type of, and make sure you don't have high blood pressure, over-the-counter decongestant, Zyrtec, Allegra, Claritin D, Mucinex D, any of these decongestants can be helpful. We use something here called D-Hist. That's a natural decongestant, but anything to dry you up so you don't have this pressure and this sinus inflammation is always also very useful. The other thing is, and this is very useful over the counter, is just go get a temporary nasal steroid to use. So Flonase, Nasonex, it's a nasal steroid. Pharmacists can help you. Couple sprays in each nostril once a day, and no longer, in my advice, longer than 1 week. And the reason is because it can make you prone to infection if you use it too long, and it also can hide and cause yeast overgrowth and make you more prone to infections. And it's not truly treating the underlying problem, but it's de-inflaming you temporarily, and it can give you a lot of relief. Now, if needed, there are medications for this, for the dizziness and the spinning, for nausea, and for the head position. We can use if we have to, but usually those are things that are very useful. Now, if you have adrenal issues or if you have chronic vertigo, I really, really highly recommend you see a functional, personalized medical physician or provider, practitioner like us here at Longevity Health Institute in Southeastern Michigan. Not just me, our providers can do this any day, every day. We do it all the time. Is we can reverse and heal this. And why? Because it just takes a little bit of a personalized deep dive approach into knowing your adrenal function, because that can make you prone to chronic benign positional vertigo. And also, if you harbor chronic viruses, we have to build your immune system and get rid of those viruses. So hopefully this enlightens you. Share with others. It's a very common condition. I see it every year, usually again bookended at the times of the year of spring and fall in the transitional weather changes, but it is very treatable, very curable, if you will, if you deal with it and suffer with it chronically. And here at Longevity, we can always help you with that. So remember these key points, and we're here to always help you and always take a personalized medical approach, especially functionally, to deep dive into your health so that you thrive and not just survive. This is Dr. Lorenz. Keep being well.